The hospital's corridors were always dimly lit, but today they felt like an abyss. Dr. Alara Vex navigated through the familiar maze with an air of detachment, her eyes fixed on the clipboard in her hand. She had seen it all, the routine cases, the desperate pleas for help, and the endless forms to fill out. But something about this morning's schedule felt off. Her first patient was a young woman named Kaida, admitted for what the notes described as acute anxiety. Dr. Vex reviewed the file quickly, her mind already preparing for the inevitable questions about medication and therapy plans. She knocked on the door, and when no one responded, she turned the handle to find it unlocked. Inside, Kaida sat in bed, staring at a small, intricately carved wooden box on her lap. Dr. Vex's eyes widened as she took in the sight. Kaida's fingers were wrapped around the box, as if holding onto it for dear life. "Good morning," Dr. Vex said softly, trying to sound reassuring. Kaida didn't look up. Her voice was barely above a whisper when she spoke. "I'm not supposed to open this." Dr. Vex felt a shiver run down her spine. Something in the tone made her uneasy. It wasn't fear or desperation that Kaida exhibited. Instead, there seemed to be an almost resignation about her. "What is that?" Dr. Vex asked, trying to keep her voice neutral. Kaida's gaze drifted up, and for a moment, their eyes met. "My treatment plan," she said flatly. "I'm not supposed to open it until the therapist comes." Dr. Vex exchanged the clipboard for a pen, scribbling some notes in Kaida's chart without looking up. Her mind was racing. Something wasn't right here, but what? Was this another case of overwrought parents or simply a misdiagnosis? As she finished writing, Dr. Vex caught sight of the clock on the bedside table, 8:47 a.m. sharp. It was always a little peculiar how the hospital's routines seemed to synchronize themselves to the exact minute. She looked up to find Kaida watching her with an unerringly steady gaze. And in that moment, Dr. Vex knew she had walked into something far more sinister than just another case file, something that threatened not only this patient but also herself and everyone else within these walls.